Hi everybody and welcome to this short educational video in which I'll discuss vertical root fractures in molar teeth. Vertical root fractures are very difficult to identify clinically, but they're a common cause of endodontic treatment failure. Therefore, if we have hints and tips which can be used in order to successfully locate and successfully identify vertical root fractures, hopefully this will aid in your treatment planning and management of such cases in your own clinical practice.
In this case, the patient was referred for endodontic retreatment and removal of a separated spiral filler in the first molar tooth. During the assessment of this case, a vertical root fracture was detected in the second molar tooth as an incidental finding. When examining the periapical radiograph, there was evidence of apical periodontitis affecting the first molar. The second molar tooth also showed evidence of disease, with a periapical radiolucency also affecting the mesial root and bone loss in the furcation. The second molar was found to have a suspicious fracture line. The tooth was otherwise unremarkable, with good periodontal health and a moderate-sized amalgam restoration. If a fracture line communicates with the pulp chamber and runs subgingivally, there will be continued leakage of bacteria or nutrients for bacterial growth into the pulp chamber regardless if the tooth is endodontically treated or not. Therefore, the risk in this situation is for the fracture line to continue subgingivally as shown. Our first clue to suggesting the presence of a vertical fracture lies in the periapical radiograph. This case shows there is some distance between the previous caries, current restoration and the pulp chamber, making bacterial ingress via this route unlikely. If a vertical fracture line exists, bacteria will be able to access the pulp and root canal space via this pathway. This explains the presence of a furcation radiolucency. Bone and periodontal ligament breakdown along the line of the fracture can often be detected as an isolated periodontal pocket. The gingival sulcus is examined using a BPE or perioprobe, as can be seen here. Note that the probe disappears into the area of tissue breakdown, which is adjacent to the suspicious fracture line. So, the combination of factors that would give us suspicion of a vertical root fracture being present in a tooth include no deep caries or obvious restorative reason for the loss of pulp vitality, radiolucencies affecting the lateral aspect of a root or a furcation in a molar tooth, and an isolated periodontal pocket in a patient with otherwise good periodontal health. So, if you enjoyed this video, please remember to like, subscribe on social media channels where more content will be added regularly.